Hello, it's me again, Tiffany. Today I wanted to share my diagnosis story, and this would be part one. There's two parts to it. So this is kind of like how everything first started back in June of 2020 and up until like the end of 2020. And I wanted to share that. And so actually I'm working off of a list that I had started back then in my phone. I started a blessings list, and then just anytime that something I like saw God working through this cancer diagnosis story or through anything, I wrote it down on my phone so I'd have something to look back on. And it really acts as like a really good timeline to the whole first part. And so I am 32 now. I was 31 back in like May last year, and I'm fairly healthy. I have never been into the emergency room. I've never I don't get sick very often, normal things. And I don't have any chronic illnesses. I didn't have any chronic illnesses. I exercise. I try to eat healthy-ish. And both my husband and I are pretty healthy for our age. And so that it was just this whole thing was a really big shock. I last year, like in the spring, started feeling some pain in my left breast when I would run, when I would hug my husband, and also when I would like my toddler would like hug me or jump on me. You know how they could be kind of rough sometimes. I started noticing some pain. And then after a couple weeks of that, I did a self breast exam, and I noticed a couple lumps. So initially I kind of thought it was probably, because I did have a history when I was 19 of a mass on my right side, and it was fibroadenoma, and it was a benign tumor. We did end up having it surgically removed. I'm not sure why. I know a lot of times they just leave it now and just kind of watch it, but this was like 2009. So it was surgically removed, and I initially thought, okay, this is probably what it is. I talked to my husband, we agreed I should definitely go in and see my gynecologist OB, who had been seeing for years about this issue. Now I had been trying to get in to see my OB for a couple months, but because of COVID, it kept getting pushed back a month and a month. It was supposed to be a routine visit, and they weren't doing it. So I ended up calling and asking, this was in May, and I didn't have an appointment until June. That was like what I got pushed back to, and it was likely gonna get pushed back again. And so I did end up calling and asked if I could be seen sooner because I was having like this breast issue. So they were able to see me, and it was within a couple of days of me calling, they were able to see me. And I remember thinking, like, in the back of my mind, when I would think about this issue, and it wasn't extreme pain, and when I had Googled things, it said that pain is not normally associated with cancer. And so it kind of was like, oh, okay. But for some reason, in the back of my mind, I had this feeling that, and I am a pretty positive person. I I've never really had any health issues. I generally look on the positive side of things. I always see the glass half full, and I'm always bringing my husband down, from the worst case scenario. I'm like, yeah, it'll be fine, everything will be fine. That's usually how I am about like everything in life. But for some reason, for this situation, I was having doubts that it was going to be fine. And looking back at it, I see that it was God kind of preparing me for a more serious issue. And I talked to my husband because I'd been thinking this over for a while, and it felt weird to think this isn't going to be okay because that's not my personality. And also you want to trust that God, I wanted to believe that God was going to make it okay. And I don't believe in positive thinking or anything, but even when I would try to pray these feelings away, it didn't feel right. And again, looking back at it, I see it was God speaking to me. But I told my husband, um, actually I told him after that appointment. Okay, so I went to my appointment. My OB did an exam. She felt the masses as well. She wasn't too concerned, but she did tell me to call, or she gave me a referral to call and get an ultrasound and a mammogram. So I tried to call the normal hospital I go to, but because of COVID, they weren't seeing patients. I think they were seeing patients, but I didn't make it clear that this wasn't a routine visit, that it was like for an issue, a current issue. So they scheduled me out for like over a month away. And when I told my husband, he again said, you know what, you should call U of M. So I called the University of Michigan, and they got me in within 2 weeks to be seen there. And looking back at it again, that's why it's on my blessing list, because that was 100% God working it out so that I could be at one of the best hospitals for this type of issue. So in between that waiting period, the 2 weeks-ish when I had my, before I had my ultrasound and mammogram, I was still having those doubts and feelings that this wasn't gonna be simple. And one night I talked to my husband. I was really scared to tell Paul this because it just wasn't me, and it was just like, it didn't feel, I don't know, it didn't feel like helpful. But one night I told him, I said, Paul, I just want you to know that I know I haven't got any results yet, but it's not gonna, God's telling me that this isn't gonna be okay, but it's going to be okay. You know, and like saying that out loud was really hard for me to say and to admit, and it was difficult for Paul to hear as well. He took it really well, but he took it really seriously, and I think it really changed his mindset and his prayer life right then and there. I know it did. So this was probably just a couple days before my appointment. So I go to the U of M. It's supposed to be an hour-and-a-half appointment. We had a babysitter. My sister-in-law was going to watch Charlotte for a couple hours. Supposed to take hour-and-a-half. And then it ended up taking 4 hours because they kept running more tests. They wanted to do, I ended up getting 3 different mammograms with lots of wait time in between the doctors looking at the results. And after my first mammogram, I remember the technician like going back to the computer to see the results, and I remember her like sighing and like making a noise, and I like thought like, she didn't just do that, did she? And like I'm not gonna read into this, but she totally did, and I think she was just surprised. And then so I had a couple hours of these tests, and then an ultrasound where they looked at everything, and I showed them where I was feeling the pain and the masses. And there's 2 small masses that I could feel, and then just like an area of like tenderness on my breast. And then the doctor came in, and again, Paul isn't with me. He's actually in the car. So I kept like updating him and texting him like, oh, they're gonna do another test. They're gonna do another test or another image. They're gonna do an image with this machine. And he was like in the parking garage waiting. I think he had his computer and he was like working a little bit on some emails. And then the doctor came in after the ultrasound after a while, and she told me, and this was all just like kind of surreal, especially because like Paul wasn't with me, and like everyone's wearing masks, and you can't even like, you don't even really see the people, the doctors that you're talking to. Like their pictures look so different like on their badge than like what they look like with a mask on, and it just felt like kind of distant. But she told me that there were lots of concerning areas on my ultrasound and my mammograms, and that it didn't look good, and that it's likely cancer, and that they wanted me to come back in like the next week to do a biopsy to confirm. But she was just preparing me that it was like the images and everything they could see like was in line with what they see with people who have, you know, for cancer images. I guess that's how you say it. I didn't cry. It was almost like a relief because like God had been like kind of preparing me for this. And so I went out, and I honestly, for some reason, can't remember too much, but I told Paul about this. And then we came home, and my poor sister-in-law like was supposed to just watch Charlotte for a couple hours, and it turning into like half a day, but she was really cool with it. um so yeah, and so I still have like a positive attitude, and I just knew that God was gonna take care of it, and it wasn't okay, like it was serious, but it was gonna be okay. And that really described my attitude for the majority of 2020, with this diagnosis. I just I just had a peace about this whole situation even before I officially knew that it was cancer. So I come back the next week for my biopsies. I had 2 biopsies done. One of them was like an ultrasound guided biopsy, and they placed like a clip to kind of track the tumor, and the other was a core needle like robot biopsy, which was interesting. And the nurses were so sweet and kind, and I have just a new like profound love for the medical staff, and especially nurses at the hospital, because I hadn't really had much interactions before, but I have had a lot of interactions the last year now. So I got the biopsies done, and then couldn't pick up Charlotte for a couple days. You know, I had to like take it easy, which seemed hard then, but then looking back on it, like there were other things that were harder. And 2 days later, oh, actually, it was a couple days. I got the biopsies done on a Friday, and then like it was like the weekend, and then like I think it was on like a Tuesday that we got the call from the doctor there that I had cancer. And my diagnosis back then was I had 2 types of cancer actually. One was invasive lobular carcinoma, and the other was DCIS. And the invasive lobular carcinoma was like two small masses or tumors, a couple inches apart, and they were hoping that they were not connected, and they were not. And the DCIS was like speckles of calcification over 10 centimeters of my breast. And because of that, like right away on the phone, she said like they're gonna recommend that I have a mastectomy, because a lumpectomy wasn't feasible, because the area that they would have to remove just took up too much of my breast. And I took that well. Honestly, that was the first time that I cried, and it wasn't tears. Honestly, it was not tears of sadness. It was tears of relief, just to know. I'm the kind of person who just wants to know, wants to have a plan, wants to like move on and get it over with, or like just start the process, start the next thing. And so it was like a relief. So my husband and I got that news, and we immediately prayed about it, and we talked it over a lot, and I just honestly, I was fine. I just was like, okay, we're gonna do this. Like I was just ready to fight it, and I just had this peace that God immediately gave me, and that He was gonna take care of me, and that like it's not okay. It's a bad a disappointing or unexpected thing that was happening, but it's gonna be all right. So that was on, I want to say it was like a Tuesday. It could have been a Monday that we found that out. I don't quite remember the dates. And then we told our family, we told our friends. We told, like, I think we called our pastor and asked for prayer for our pastor, but we didn't like make it known to like the public quite yet. And then 2 days later, I took a pregnancy test. I was not expecting it to be positive. We had been trying for like 9-10 months, and with Charlotte it took a couple years to get pregnant, and we just kind of figured it might take that long again, and we weren't super serious about trying this time. But I took a pregnancy test because I was late. Actually, I woke up my husband at like 6 in the morning, and I had already taken one pregnancy test, and it was like the last one, and it was really old, and I didn't trust it, and it came back positive. And then I told Paul, I woke him up and I said, Paul, I think you need to go buy a pregnancy test. And he's like, right now? I'm like, well, you can wait. And he just immediately got out of bed, and he went to like a gas station pharmacy that's not far from us, and got like 3 different kinds of pregnancy tests, and then came back, and then I took them. and I think I took 2 more, and they were both positive. And so we kind of like laid in bed in awe, and then we both, like, it was like kind of I don't know if this is weird, but it was like kind of humorous that this was happening, because we had stopped trying when I was told it was probably cancer, so just a couple weeks, but this happened beforehand. So when I took the test, you're like four-ish weeks pregnant technically. And yeah, it was humorous because it was so clear that this was God's doing, that like God had a plan for this, and like he made this happen 2 days after finding out that I had breast cancer. And it complicates a lot of things, but it also just brought us so much joy and so much peace that God was gonna like take care of us through all of this. And so I'll do a whole nother video, I think, on the pregnancy portion of this. But so yeah, I was pregnant. And so then we immediately were like, all right, we need some prayer warriors, because this is a big deal. This is like going on. And then immediately God just opened up all these doors. My best friend, her boss is a breast cancer surgeon, and I still have her on tap, and email and text to call anytime in the night. And she's been like an amazing support and second opinion and encourager, and just so helpful throughout this whole process. And she has dealt with multiple women who are pregnant with breast cancer, and just reassured so many areas of concern for us, and just guided us along this process, because this is all new, and it is still all new to us. And so what did we do? Oh, we told our friends and family, and then like we waited like a week, and then I like made an announcement, like public, asking for prayer, like my social media pages, and telling people that we were pregnant and I had cancer, but God obviously has a plan. His hand is all over this. We had seen it. We had extreme comfort from him during this, and we were just gonna power through it. And that's exactly what happened. So because of COVID, we had lots of virtual doctor appointments, like through Skype and things. And they ended up scheduling me for mastectomy about 2 weeks later. And I was able to have, and there'll be another video about the mastectomy surgery, but I was able to have reconstruction done at the same time. And it was a long surgery, and it was a really hard recovery, especially like not being able to take certain medications because of the pregnancy, like for pain. And because I had the reconstruction done, it does just make it a harder recovery. And so that was difficult. And then we prayed throughout this whole thing, and we had hundreds probably of Christians praying for us, and it was just amazing. And the support and the love I felt from my Christian community, from my church family, from my own family and my friends was just so helpful, and it just guided us through. And Paul and I grew closer throughout last year. And yeah, so some of our specific prayers so I'm going to word this like we thought were answered, was that our biggest prayer is we wanted just only surgery. And if we could be only surgery and then get away with no other, not get away, but not need any other treatments, that would be the best. And that's what it looked like. My Oncotype score came back really low, so that meant that the cancer that I had didn't need chemotherapy. And then my genetic testing came back clear, so that meant that there's no like genetic reason why I would like need any other surgeries, or like another mastectomy, just as like being proactive. And I didn't have to worry about my daughters being a carrier of that gene. And then also yeah, so God just like answered all those prayers. After the surgery, the thing that wasn't ideal was that my margins were not clear. So that meant that the tissue that they took out when they tested it, there were some cancer cells that were really close to the border. And what that means is that there could be a possibility of recurrence. So if I wasn't pregnant at that time, I would have started radiation right away. But you cannot have radiation when you're pregnant. You can have chemotherapy when you're pregnant. You cannot have radiation. And so that was off the table, and the plan was just to kind of wait, have the baby, then do some more testing. It wasn't guaranteed it was going to come back. Have some more testing, and then start hormone therapy, like hormone blockers after, because I didn't mention this, but the cancer that I had was estrogen and progesterone positive. So it like responds to those hormones in your body, and so we need to suppress those. Can't suppress them during pregnancy, for obvious reasons, and your hormones kind of go crazy during pregnancy as well, and so that was a concern. But it looked like God answered our prayers. No chemo, no radiation at that time, just surgery, and then like 5 years of medication. And so we were good. The pregnancy was hard. I'll make a video on that, as I said, but we were doing really good. We took it one step at a time. God just wrapped his arms around us in comfort and showed us so much love and support from our community. And it was really encouraging. And we tried not to be, I would say, prideful or like get too comfortable, because Paul and I both, one thing that God worked on us on at the beginning was that we always took our health for granted. And I would say even like dabbled a little bit in pride in our health, like, oh, we're so healthy, like we have our health, and like we just like kind of like would talk about that or like think that, like both of us. And then it was just like that God just like took that, like I am not healthy. When we redid our insurance, our health insurance for Paul's work, you have to like click like online your health status, and we always clicked super healthy, really healthy, like no chronic. And this year when we redid it, I told Paul, like, I think this is in December, I'm like, I think you need to put poor health for me. And he's like, no, we're not gonna put poor health for you. And I'm like, I think we need to. Like, if you just look at how this last year was, like, I'm not healthy. And so we did choose that. It didn't affect our insurance at all. I think it was just like, I have no idea why they asked that. Yeah, so we tried not to be prideful, but we just felt so blessed that God answered our prayer, and we were so thankful for it. And we still are thankful for it, but things changed. So just because I have this blessing list here, I do want to just kind of highlight a couple of things that was just so obvious God working out with my diagnosis last year. Dr. Benzenhaver, who was the doctor I recommended my second opinion, was just amazing throughout all of this. And like she even like set it up for me to have like an exam done at my friend's house. I could have went to go see her, but I ended up, she works towards Detroit. I ended up, and she used to work at U of M, which is cool, and she like knew all the doctors there and handpicked my surgeon, handpicked my plastic surgeon, recommended which oncologist I should be seeing. She just amazing. But we recently have become debt-free, so we didn't have to worry about finances. I recently had quit my I'm a stay-at-home mom, but I also was like teaching online. And before any of this, I had decided to stop doing that. And so it's just like a level of stress gone. My sister-in-law had some connections through her work, and she recommended, or her bosses recommended like a high-risk OB, and it was the same high-risk OB that my Dr. Benzenhaver recommended. My in-laws are both retired and live like less than 10 minutes away, and have just been so helpful with watching Charlotte and now Abby throughout all of this, and like been there for anything. And my mother-in-law is a nurse, and so just having like that like questions about the medical field, and she was a nurse at U of M where I'm having all this treatment done. Our amazing church family. My sister was able to fly up and spend like a week here taking care of me after my mastectomy. I have had like neighbors. I have a Christian neighbor who like came over and dropped off some food and prayed with me. Friends who would call and pray with me. I remember we had a lot of porch front dates last year in the summer, and just sitting out there praying one morning and having like when I was like getting a little down, having like 4 different friends reach out and text me like all at the same time, encouraging verses and songs and letting them know they were thinking and praying for me. And so there is a whole lot more, and I'm sure some of it will come out, but it was just so clear and evident God working through all of this, and he still is. And I look forward to seeing how this ends. So my next video will be about part 2 of my diagnosis, which was a little more scarier and honestly hit me harder. I had a harder time, and still I'm having a hard time dealing with this part of my ongoing health journey. So that will be next. So thank you so much.